NU 13114D03 Nursing and Healthcare I. Covering Unit #I, Chapters number 1 and 4. Nursing History and Health Promotion. 1. What was significant about World War I in terms of the advancement of nursing and nurses? A. Nurses primarily served in the front lines. B. Nurses died in combat for the first time. C. It highlighted the need for more and better prepared nurses. D. It prompted ratification of women's rights in 1918. 2. Who is known as the founder of modern nursing? A. Dorothea Dix. B. Lystra Grutter. C. Sisters of Charity. D. Florence Nightingale. Which was the focus of the first formal training programs for practical nurses? A. Home nursing. B. Midwifery. C. Hospital care. D. Care of soldiers in the battlefields. 4. Which group of nurses developed standardization of nursing requirements for practical nursing? A. American Nurses Association. B. Joint Committee on Practical Nurses and Auxiliary Workers. C. National League for Nursing, NLEN. D. National Federation of Licensed Practical Nurses, NFLPN. 5. Which of the following statements is true? Prior to World War I, most nursing was done in hospitals. The first real school of nursing was in England. The end of World War II increased the importance of practical nurses in hospitals. Florence Nightingale cared for the sick during the Civil War. 6. You are planning care for a patient with several conditions. When using the holistic model of health, you identify which internal forces are impacting the patient's health. Select all that apply. A. Family. B. Heredity. C. Neurochemistry. D. Mind. E. Body systems. You receive notice of an endemic in one country in South America. In which way would you describe this disease outbreak? There is an illness that spreads over several countries. The disease affects only a particular country. There is an illness that spreads over several continents. The disease affects a large number of people living in a community. The public health nurse receives a report on the number of adults in the state who were admitted for substance abuse treatment. Which location would the nurse recommend for education to address this health concern? Senior living centers, workplaces, high schools, churches. You are completing a health history with a patient. On which social determinants of health will you focus to promote the patient's health? Select all that apply. Daily use of substances. B. Type of housing. C. General hygiene practices. D. Access to transportation. E. Average daily diet. 10. You review the Healthy People 2030 objectives for a community health presentation. On which health behaviors would you focus during the presentation? Select all that apply. A. Avoiding tobacco and nicotine. B. Increasing physical activity. C. Healthy eating. D. Pregnancy and childbirth. E. Nutrition. Covering Unit #4, Chapter number 12. The nursing process, your role. 1. A patient reports to you that he has a headache. This is an example of A. Objective data. B. Emotional data. C. Subjective data. D. Psychosocial data. 2. A patient was admitted for severe dehydration related to vomiting and diarrhea. He was given intravenous fluids and medications, and his condition has improved. In reviewing the nursing care plan, you noted the resolution of these problems. This is an example of A. Evaluation. B. Diagnosis. C. Implementation. D. Planning. 3. Applying ice packs to a sprained ankle is an example of which phase of the nursing process? A. Implementation. B. Evaluation. C. Planning. D. Diagnosis. 4. The summary of patients' actual or potential problems is referred to as A. Evaluation, B. Planning, C. A. Nursing diagnosis, D. Implementation. 5. Interviewing a patient on admission is a form of A. Planning, B. Evaluation, C. Data collection, D. Implementation. 6. A patient reports that he has not urinated in the past 8 hours. What is the proper course of action for the LVN? A. Notify the RN. B. Tell the patient to drink more fluids. C. Ask the nursing assistant to insert an indwelling urinary catheter. D. Insert an indwelling urinary catheter. 7. Reviewing and implementing the recommendations set forth in the nursing care plan is an example of AN. A. Dependent role, B. Independent role, C. Interdependent role, D. Implementation role. 8. A patient comes to the clinic with an exacerbation of asthma. Using Maslow's hierarchy of needs, on what level would difficulty breathing be placed? A. Self-esteem, B. Self-actualization, C. Physiologic, D. Safety. 9. The legal role of the LVN is determined by the A. NCLEX PN, B. Nurse Practice Act, C. AMA, D. ANA. 10. The guide used by the RNs to determine an appropriate nursing diagnosis is set forth by A. NOC, B. NCLEX, C. NANDA, D. NIC. 11. What does stand for ADPIE? A. A delicious PIE. Assessment, diagnosis, planning, implementation, evaluation. 12. Define the nursing process. A. Assessment. What data is collected? B. Diagnosis. What is the problem? C. Planning. How to manage the problem. D. Implementation. Putting the plan into action. E. Evaluation. Did the plan work? 13. What are the steps of LVN nursing process? Data collection begins on admission. Performed at every patient encounter. Needs verification or validation. Objective data. Observations. Assessment. Labs. Diagnostic tests. Subjective data. Verbatim. Reports. 14. Is data verification important in nursing process? Yes. Verifying data in nursing process is an important step in critical thinking. Validation/verification is the act of double-checking or verifying the data to confirm that it is accurate and factual. Never assume, always validate. 15. What is planning in nursing process for LVNs? LVNs? Planning includes assisting the RN to develop nursing diagnosis, outcomes, and interventions. 16. Describe Maslow's hierarchy of needs. A. Supports the concept of holistic approach to care. B. Recognizes individuals as whole beings. 17. Define the steps of Maslow's hierarchy of needs. A. Self-actualization. Morality, creativity, problem-solving. B. Self-esteem. Confidence, achievement, respect to each others. C. Love/belongings. Friendship, family, sexual intimacy. D. Safety. Security of body, employment, family, health. E. Physiological. Breathing, food, water, sex, sleep. 1. What are the steps for nursing process? A. Data collection. B. Planning. C. Implementation. D. Evaluation. 18. Briefly describe the nursing process. A. Data collection. Data collection, assessment, is a systematic gathering and review of information about the client, which is communicated to appropriate members of the health team. B. Planning. It involves assisting the RN in the development of nursing diagnosis, goals, and interventions for a client's plan of care while maintaining client safety. C. Implementation. It is the provision of required nursing care to accomplish established client goals. D. Evaluation. It compares the actual outcomes of nursing care with the expected outcomes, which are then communicated to members of the healthcare team. 19. How should a nursing care planning be? The nursing care planning should be client-oriented, measurable, and time-bound. Q. Which types of the nursing processes does the LVN participate in with the greatest degree of independence? A. Data collection and implementation. B. Planning and implementation. C. Goal setting and evaluation. D. Evaluation and data collection. Q. The student nurse asks, how does knowing the nursing diagnosis assist the LPN/LVN? The best response is based on understanding that. A. Knowledge of the nursing diagnosis ensures a cure for the patient. B. It permits the practical nurse to go beyond the scope of practice. C. This step makes the practical nurse equal to the medical doctor. D. A nursing diagnosis identifies the patient's problems. Q. The nursing care plan requires the nurse to ambulate the patient twice daily. The phase of the nursing process in which the nurse is participating is A. Implementation. B. Planning. C. Assessment. D. Evaluation. Q. A patient states, I am feeling left side chest pain that radiates to my left arm. This is an example of subjective data. A. True. B. False. Which of the following are considered subjective data? The patient's mother tells the nurse that the patient needs a ride to the clinic for follow-up. The patient tells the nurse that he has a headache. The nursing assistant tells the nurse that the patient vomited. The physician tells the nurse that the patient needs a chest X-ray. Q. Which of the following is the primary reason that LPNs are taught to use the nursing process? A. To resolve patient problems. B. To diagnose disease. C. To provide reimbursement. D. To communicate with health team members. The LPN/LVN learns at report that a patient's priority problems are pain and inability to ambulate associated with arthritis. During the patient's bath, he becomes short of breath. The LPN/LVN should implement interventions based on A. The priorities given at the report. B. The patient's identified strengths. C. The patient's changing status. D. Information obtained from the Nursing Outcomes Classification, NOC, project. Q. When a nurse uses Maslow's hierarchy of needs to prioritize patient problems, which problem would be considered the highest priority? A. The patient has deficient knowledge about the condition. B. The patient is experiencing marital difficulties. C. The patient is unsteady and may become injured. D. The patient is acutely short of breath. Q. I feel like I can't catch my breath is an example of A. Evaluative data. B. Subjective data. C. Affective data. D. Objective data. Q. Which outcome would be appropriate to include in the nursing care plan of a patient who has undergone total knee replacement? A. The patient will be stronger by date. B. The nurse will help the patient ambulate the length of the hall twice daily. C. The nurse will evaluate the patient's strength based on his ability to ambulate in the hall on the first postoperative day. D. The patient will transfer from the bed to a chair with the assistance of a walker and one staff member by the third postoperative day. Q. The patient's problem has been identified as insufficient intake of oral fluids. Which outcome statement is best? A. The nurse will provide the patient with 100 milliliters of fluid hourly. B. The patient will ingest 1,500 milliliters of oral fluids during each 24-hour period. C. The patient will request fluids when thirsty. D. The nurse will encourage fluid intake by the patient. Q. A nurse is gathering data about a patient. Which of the following is subjective data? A. The patient is experiencing sinus tachycardia and peripheral edema. B. The patient is short of breath and coughs up green sputum. C. The patient has gained 1 pound within the past 24 hours. D. The patient complains of excruciating, crushing chest pain. Q. During the assessment phase of the nursing process, the LPN/LVN is expected to A. Plan interventions to implement for the patient. B. Collect data about the patient. C. Establish goals and outcome criteria. D. Determine whether established goals have been met. Q. A nurse notes that a patient is experiencing increased peripheral edema and has urinated 20 cubic centimeters of urine in the past hour. This is an example of objective data. A. True. B. False. Q. Which of the following are examples of objective data? Select all that apply. A. Patient has an offensive body odor. B. A patient complains of substernal chest pain. C. A patient falls when ambulating to the bathroom. D. A patient states, I feel a sense of impending doom. E. A patient complains of feeling anxious. F. A patient complains of feeling stressed. 20. What is the subjective information in nursing process? Subjective information is based on the client's opinion. This usually includes feelings of physical discomfort, anxiety, and mental stress that are more difficult to measure. 20. What is an objective information in nursing process? Objective information includes data that the nurse can verify. It is also known as signs. A physical assessment provides objective data. 21. The nursing process has impacted the nursing profession. How did the origination of the nursing process in the 1950s change the course of nursing? It provided A. Reasoning model. B. Specificity model. C. Quality model. D. Critical thinking model. 22. Which reason is primary for the development of the nursing process? A. Differentiation of nursing from other allied health professions such as social work. B. Establishment of nursing as an important component of nursing care incorrect. C. Establishment of a unique and complementary role to physicians in patient care. D. Publication of textbooks that were specific to nursing. 23. What does evaluation accomplish in the nursing process? A. Assesses on a weekly basis whether the patient is making progress. B. Contributes to knowledge of the patient's needs. C. Ensures that procedures were performed correctly. D. Compares what was intended as outcomes in care against what was actually accomplished. 24. Which information provided by a patient is considered subjective? A. Pain. B. Blood pressure. C. Temperature. D. Weight. 25. Which information from a patient is considered objective? A. Tenderness. B. Burning. C. Weight. D. Anxiousness. 26. What patient data is considered an emergency and requires immediate reporting? A. Temperature of 99 degrees Fahrenheit. B. Chest pain in mid-chest. C. A rash. D. Diarrhea. 27. Which response is considered to be appropriate from a nurse? A. Am I correct in saying that you are worried? B. Everything will be okay. C. Don't worry about anything. D. You know you shouldn't smoke. 28. Which type of setting would most likely use a multidisciplinary care plan? A. Medical office. B. Intensive care unit. C. Obstetrics. D. Long-term care. 29. Which essential action applies to the plan of care for a patient? A. Reporting of progress or lack of progress. B. Discussions with the team. C. Documentation of the plan of care. D. Participation in patient care conferences. 30. What data should be collected by LPNs/LVNs? A. Periodically throughout a shift. B. With every patient contact. C. When finalizing a nursing diagnosis. D. When measuring patient outcomes. 31. A nursing diagnosis is finalized by the registered nurse, RN, who uses NANDI as a source. A. True. B. False. Critical thinking questions. 1.